This is Fox 19 Now.
Plus, the peak of flu season is upon us. Tips for keeping those germs from spreading when a family member gets sick.
Germs, cooties, whatever you want to call them. Once a cold or even worse, the flu infects someone in your home, it's hard to keep it from spreading. This morning, Dr. Steve Schwartz says creating a safe room can help stop the bug. Good morning.
Good morning to you.
We've got a plethora of supplies here today, so let's get right to it. First off, why do you want to have a safe room?
Well, the safe room is a way to take care of a family member without getting the virus to spread to everybody else.
How do you create that?
So what you do, it starts with a clear plastic tote.
Okay.
You get your toolkit together.
And we got it right down here, right? I'm going to be the doctor's assistant today. So you're saying you can really just have everything in your house ready to go?
You can have everything in one little kit, one little toolkit.
And what's in this kit?
Well, there's four components to the safe room. One is the sick person, the other is the safe room itself, the other is the caretaker and how you kind of protect the caretaker, and you do it in layers. And then the fourth component is the toolkit itself.
Okay.
And how to use all the items. They're laboratory tested, a good number of them. All that's explained in a free ebook.
And where can you get the ebook at?
You can get it at the website www.flunata.com.
Okay, flunata.com. So let's talk about a few of the things we see up here. A lot of cleaning supplies.
Yeah, so this is what you would have on an entry-exit stand. This would be outside the safe room.
Okay.
This is what the caretaker would come into as they kind of gear up. So you've got hand sanitizers. These have been laboratory tested. You have wipes. These have been laboratory tested. You have Flunata, which is a nose and throat spray. It also has been laboratory tested. And you have N95 masks, which are different than the surgical masks. So if you see this number, N95, it means it's been laboratory tested.
Okay, so this is outside to make sure you're not carrying it back and forth. And then inside, what do we have here?
Well, inside you have all the things that you'd normally use to, take care of somebody that's coughing, sneezing, with cold and flu symptoms.
Okay, I see a lot of different things, including this, which is making some pretty great music. What is this right here? It smells wonderful.
Well, this is actually what's called a diffuser. It has essential oils in it, and it puts out humidity. So you can think of it as a humidifier that smells really nice, and the essential oils are kind of a nice bonus as well.
Why do you want a humidifier? What does that do for the patient?
So what it does is it'll get into the mucous membranes and basically allow the mucus to clear much better.
Okay.
Much faster.
And then you've got your thermometer and some liquids over here as well. What else do you recommend to make sure that you are not going back and forth? What's one of the biggest mistakes you see from people that are creating this, one person gets it and the entire household has it?
So the biggest mistake people make is eating common meals together, because the virus can spread in that context, coughing, sneezing. You really have to stay about 6 feet apart to minimize it, and that's the whole concept of the safe room. It's isolation. So
6 feet apart.
6 feet. Yes.
Okay. Yeah, and I think we hear that so often, where one child gets it and they pass it on. You're not being mean by sticking them in a different room. You're being safe.
You're being safe, absolutely.
Anything else that would make this that you think is an essential to have that you want people to pick up?
Well, I think the caretaker's roles is the most important.
Okay.
And it's very flexible. Some people, they probably aren't going to use the mask. But it's a layered approach. But they might instead use the Flunata. They may not use gloves, but they may use the hand sanitizer. And all that's explained in the ebook, and the extent to which you want to use each and every one of those.
I think it's important to get this now before flu season really ramps up. Flunata.com is where you can find that ebook. Dr. Schwartz, thanks so much.
Thank you.